Welcome to the Essence of Health Tea Time podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. Get this. 24.3 million Americans enrolled in health insurance in 2025, and 4 out of 5 of those individuals found plans for just $10 a month or less. There's much debate over the Affordable Care Act and its impact on healthcare, but listen to this tea. Starting January 2026, those same people with the affordable health insurance plans are now seeing their premiums spike by over 114%. We're talking about going from $10 a month to potentially $200, $300, or even more. That's not a typo, folks. That's a 114% increase that's hitting millions of families this year. And if you're sitting and thinking right now, well, that doesn't affect me, hold on, because even if you're not on marketplace insurance, what's happening in our healthcare system right now affects us all. And I'll give you the tea on this today in a moment. Welcome to the Essence of Health Tea Time podcast. I am your host, Dr. Shayla Toombs-Withers, board-certified obesity medicine and functional medicine physician and certified hormone specialist. Welcome back for another episode of season 4 of the podcast with our fresh new format that I'm actually really enjoying. Instead of just diving into health topics like we did for the past 3 seasons, we're reviewing popular health and wellness articles together. I'll share the highlights, and then I'll give you my take as an integrative and functional medicine physician specialist. It's tea time, and I hope you're ready for this piping hot tea today. Today's topic is one that affects almost everyone, but rarely gets discussed from a physician perspective. We're talking about healthcare costs, insurance, and what you can actually do about it. I'm recording today's episode at the beginning of Heart Health Month. Heart disease is still the #1 killer of Americans, and one of the important significant contributors to heart disease is chronic stress. And guess what can really stress us out? Our finances. So today, I'll be spilling the tea about health insurance, hidden costs, and a simpler way to get quality care. Today's article is brought to us from the folks over at CNN who published an article on New Year's Day 2026 titled "The ACA's Enhanced Subsidies Have Expired. Here's what you need to know." I'll place a link to the article in the show notes so that you can read it yourself and then share your take from the article with me on any of my social media channels. I'll break down for you what's happening right now in healthcare, why it matters for your overall health beyond just your bank account. And then I'm going to share with you a solution that many people don't even know exists: direct primary care, or DPC. This is the model we use at Essence of Health Wellness Clinic, and I'm going to share the tea with you on why it can really be a game changer, especially for busy women like you who want comprehensive, convenient, high quality, personalized healthcare without breaking the bank and unknown financial surprises that insurance can bring. Before we dive into today's tea, a quick note for women listening who feel unheard, dismissed, or confused about their health, hormones, weight, or energy. I want to share some exciting news with my Atlanta area listeners. I am thrilled to announce the opening of our new Essence of Health Wellness Clinic location in Atlanta, offering concierge direct care experience designed especially for you. We're currently enrolling in our Atlanta Founders Circle, and the first 10 members who enroll at our Atlanta location will receive a free comprehensive cardiometabolic lab analysis package as part of their initial assessment. This significant value is our way of saying thank you to our founding members who are joining us in bringing personalized, high-quality, integrative, and functional care to the Atlanta area. If you're interested in learning more about becoming a founding member and being one of the select 10 to grab this amazing life-saving bonus, then head on over to drshayla.com/EOH for more information. Now, keep listening and get this tea. So here's the situation. Millions of Americans have been getting help paying for their health insurance through something called enhanced subsidies. These were put into place during the pandemic to make health insurance more affordable through the Affordable Care Act and could be obtained on the healthcare marketplace. Well, those enhanced subsidies expired on December 31st, 2025. And when they expired, health insurance premiums, that bill you pay every month to the insurance company, it spiked by more than $1,000 annually for many people. We're talking about a 114% increase. Yes, a 114% increase. Now let's put that into perspective. If you're accustomed to buying your loaf of bread at the supermarket for, let's say, $3 per loaf, but now suddenly that same loaf of bread is costing you $6.42, you would have some questions, right? Also, throw in the fact that you maybe can't get this bread at any other grocery store because you can only eat this type of bread and it's only at this particular store. And even when you break down and buy the $6.42 loaf of bread, you then have to have some special bread opening scissors costing you more money to open the bread. And when you finally get it open, it doesn't even taste that great. Well, now you're following what is happening with health insurance. Now, some of you may be thinking, okay, but I don't have marketplace insurance, so this doesn't affect me. But hold on. Even if you get insurance coverage through your employer or your own Medicare, this shift in the healthcare landscape, it still affects everyone because it highlights a much bigger problem in America that healthcare is becoming unobtainable at this rate and unusable for more and more people, including for employers who may cover your healthcare coverage right now. Let's review some numbers from our CNN article. Previously, with the enhanced subsidies in place, 24.3 million people were enrolled in the Affordable Care Act plans in 2025. And get this, 4 out of 5 people, that's the majority, were able to find plans for $10 or less per month. Yes, you heard that right, $10 or less. But now, here in January 2026, without those subsidies, those same plans jump to $200, $300, or even more per month. This article highlights that people are already feeling the impact. Enrollment counselors reported that their phones were ringing off the hook with people who were panicking about these premium increases, and rightfully so. This has caused some people to switch to cheaper plans with higher deductibles. But that means that you may carry an insurance card in your wallet, but still can't get the coverage you're paying for to see your doctor until you've paid that higher deductible out of your cash. Some folks are switching to what's called bronze level plans, which may have lower monthly premiums, but higher out-of-pocket costs when you actually need care. And some people, well, they're just dropping their healthcare coverage altogether because it simply doesn't make sense to pay for a health insurance that you can't use because you still have such an outrageous deductible. And folks, I've personally seen this with my patients. Some having deductibles that are $5,000, $7,500, or even $12,000, meaning they have to pay the insurance premium every month and pay the healthcare facility out of their pocket up to the thousands of dollars deductible amount before the insurance they're actually paying for will step in and help out with any coverage at all. So let's say you found a plan for $200 a month after the subsidy expired this year. Okay, so you may be thinking, great, that's just $2,400 a year in premiums. Not too bad, huh? But then you discover it has a $6,000 deductible. That means you're paying $2,400 a year in premiums plus the first $6,000 of your medical care out of pocket before insurance even kicks in. So actually, you're responsible for paying $8,400 a year before your insurance pays a single dime. And that doesn't even count co-pays, co-insurance, lab work, or medications that may or may not be covered, because that isn't always clear with a lot of the plans. Here's some more topping for this tea: narrow networks. A lot of these cheaper plans have very limited networks, which means you may not be able to even see the doctor you want, the doctor you need, or the doctor who actually knows your health history, who may have been seeing you over the past several years. You may have to drive further away from where you live to find a healthcare provider in your narrow, limited network of options. So, in the insurance game, you may have finally found a doctor who really understands your health concerns and you have a great rapport with, but now you can't even see them because they're not in your limited insurance network. According to our CNN article, this significant problem is really hitting the middle-class Americans the hardest. You know, the people who make too much to qualify for other assistance programs, but not enough to comfortably afford those massive premium increases. This is actually most of us, folks, as the majority of Americans' income fall within the middle class. And from what I see in my practice, this includes a lot of busy professional women in their 30s through 60s, women who are self-employed, women who are small business owners, women who retired early or are between jobs, women who need quality medical care because they're going through life-changing conditions like perimenopause or menopause, and dealing with hormonal shifts, metabolic changes, and all the symptoms that come with that. So that's the situation. Insurance premiums are skyrocketing. Deductibles are high. Networks and access to care are narrow, and millions of people are being forced to make impossible choices about their health care. Now, you may be thinking, okay, now what? What are we supposed to do about it? Well, keep listening, because I'm going to share the tea with you on a simpler way to get quality care that also keeps you in the driver's seat as the one in charge of your health, not an insurance CEO in an ivory tower who is unaffected. But first, I'm going to shift gears just for a moment to talk about something the article doesn't address: the health consequences of all this stress and financial strain. Because here's what doesn't get talked about enough. The stress of dealing with confusing, expensive health insurance isn't just annoying. It's not just inconvenient. It's the irony that getting access to health care is literally affecting your health. Let me explain. When you're stressed, and I mean chronically stressed, not just the occasional, unusually stressful day, your body produces a hormone called cortisol. Cortisol is your stress hormone. It's actually essential for life. It helps you to wake up in the morning. It gives you energy. It helps you respond to acute stress, like if you needed to fight off a bear that day. But when cortisol levels stay elevated for too long, because every day it feels like you're still fighting that bear, it wreaks havoc on your body. And here's where it gets really interesting for women in midlife. Research from a well-respected peer-reviewed study called the Seattle Midlife Women's Health Study found that cortisol levels dramatically rise during the late stages of perimenopause into menopause transition. And you know what one of the biggest triggers of elevated cortisol is? Financial stress. Stress about money, stress about healthcare costs, stress about whether you can afford to see a doctor when you need one, stress about having the time to see your doctor, as it may be a 6-month wait, or you may wait 2 hours in the waiting room for your 10-minute evaluation. Stress about how to prioritize your health while battling all of these challenges. Now, let me connect the dots here a bit better for you, because this is so important. When your cortisol is elevated, especially chronically, your body can begin to exhibit this physically, leading to more anxiety, more mood swings, worsening sleep, more hot flashes, more night sweats, brain fog and difficulty concentrating, weight gain, especially around your belly, increased inflammation, and the kicker, all of these symptoms then make you even more stressed, which raises cortisol even more. It's really a vicious cycle. And while we're talking about investing in your health, let me tell you about Handful Activewear and their versatile sports bras and compression leggings designed by women for women. When you're managing decision fatigue and trying to reduce daily stress, Comfortable, practical clothing that works from your morning workout to your afternoon meetings makes all the difference. Handful is giving you 30% off for getting this tea today. Just use code EOHWC at handful.com. Now, let's talk about why the traditional insurance model fails most women who need functional and integrative medicine. And I'm going to be really honest with you here because I've worked in both systems, the traditional insurance-based medical model and the direct primary care DPC model, and I've seen these limitations firsthand. In a traditional insurance-based practice, doctors are seeing anywhere from 2,000 to 3,000 patients. They're double booked and sometimes even triple booked, meaning one or two other people were given the same appointment time as you, with the thought that if one or two of you don't actually show up, then the appointment will hopefully go as planned. But what if both or all three of you do show up? In the traditional insurance-based practice model, your doctor is rushed. That's how the model is designed on a high volume level each day. And the average appointment time, 7 to 15 minutes. Yes, just 7 to 15 minutes. That's it. And for a bit more tea from the back office, that 15-minute appointment slot also includes the time it takes the medical assistant to go through the reason for your visit, review and update your medications in the computer, and take your vital signs for the doctor. So, no, the doctor does not get the whole 15 minutes to spend just with you. It's really mind-blowing, right? So let's paint a picture. You finally get an appointment with your doctor. You've been waiting several weeks or maybe even months for this appointment. You come in with a list of symptoms and concerns. You're exhausted all the time. You're gaining weight no matter what you do. You have trouble focusing. Your joints hurt. You're irritable and having mood swings. Your periods, they're all over the place. You can't sleep or waking up 2 to 3 times per night. And you only have less than 15 minutes to explain all of this and for your doctor to come up with the plan. Your doctor, who is actually likely a very good doctor because they sacrificed a lot to get to the position to even be your doctor, and they do really care about you. That doctor runs some basic labs, maybe a TSH to check your thyroid, maybe a complete blood cell count to see if you're fatigued because you're anemic. Those results, they come back normal. You're told everything looks fine. Maybe you're just stressed and overwhelmed. Maybe you should try an antidepressant, or here's a sleep aid to try and come back in 6 months. Is that bad medicine? Nope. It's what the traditional insurance-based system allows and recommends, because in 15 minutes, with insurance dictating what tests can be ordered and what treatments can be recommended, your doctor literally doesn't have time to dig deeper. They can't order comprehensive hormone panels because insurance probably won't cover them anyway, yet your doctor doesn't even have time to explain that to you either. They can't spend 30 minutes talking to you about your diet, your stress, your sleep, your exercise, and how these things are impacting your hormones and your metabolism because your insurance plan doesn't cover for that level of care, and your doctor's clinic will likely have to close because your insurance plan won't pay them for that extra time they spent with you. They can't offer high quality, functional, integrative, and lifestyle medicine and look deeper for root causes instead of just treating symptoms because the traditional system simply doesn't support it. And here's another problem. Most insurance plans don't cover the things that actually help with hormonal and metabolic health. They don't cover extended visits. They don't cover comprehensive lab testing to determine what's actually optimal for your health. They don't cover nutritional counseling in most cases. They don't cover lifestyle medicine interventions. They don't cover most supplements, even when they're medically necessary. So what happens? You end up with a Band-Aid treatment. You get a prescription for something to manage your symptoms, but the underlying cause, the hormonal imbalance, the insulin resistance, the nutrient deficiencies, the chronic inflammation, none of that gets addressed in the meantime. And over time, those underlying issues get worse. They progress. You feel worse. And eventually, those concerns turn into diagnosable diseases that are much more expensive to treat. Think about it. If we could catch insulin resistance early and reverse it through diet, lifestyle, targeted interventions like acupuncture or massage, light therapy, and deep breathing, we could prevent type 2 diabetes. If we could balance hormones during perimenopause, we could prevent some of the cardiovascular risks that come with menopause. If we could address chronic inflammation, we could prevent or delay the onset of autoimmune conditions and chronic pain. But the current insurance model doesn't incentivize prevention. It incentivizes sick care, not preventative care. And that's a huge problem. So if you're stuck in this situation where insurance is expensive, it doesn't cover what you actually need, you can't get enough time with your doctor, and you're dealing with symptoms that are getting worse because no one is truly addressing the underlying cause, let me know on social media and tell me if this sounds familiar to you as you're listening. Remember when you were told that everything is normal, but you don't feel normal? Well, feeling fine is not the same thing as feeling your best. So stop guessing about your health. Hi, I'm Dr. Shayla Toombs-Withers, and I'm excited to share that Essence of Health Wellness Clinic has opened a new location here in Atlanta. One of the first ways we work with new patients at Essence of Health is through our foundational assessment. And to celebrate our new location, we've opened up access to join the Atlanta Founder Circle when you book your foundational assessment. Together, we'll take a deep dive into your unique physiology to uncover what's holding you back from feeling your best and build a roadmap for your path to sustainable health and wellness. And within the Atlanta Founder Circle, we're throwing in some exciting bonus offers to propel you to health with even more ease. If you're ready for care where you're actually heard, high quality care that finally optimizes your health, then visit essenceofhealthwellnessclinic.com to learn more and join us in the Atlanta Founder Circle. The essence of health is in you. All right, now keep listening because here's the good news, T. There's a model of healthcare that addresses many of the problems I mentioned. It's called direct primary care, or DPC, or you may hear it as direct specialty care, DSC, or just abbreviated as direct care. And this is how we serve our members at Essence of Health Wellness Clinic. So what is direct care or DPC, DSC? Well, think of it like this. Instead of paying an insurance company thousands of dollars for them to maybe possibly cover your care after you jump through all of the other hoops, you pay your doctor directly instead. You pay a monthly membership fee, kind of like a gym membership, but for healthcare. And in exchange for that monthly fee, you get direct, easy access to your personal physician. Now, let me break this down for you and tell you how this is different from the traditional insurance-based care. First, there is no insurance billing for your direct care services. That means no co-pays for your visits, no deductibles to meet before you can actually see your doctor, no pre-authorizations, no network to figure out, no fighting with insurance companies about whether a test or treatment is covered. You pay your monthly membership fee and your care is covered. Period. Simple. Second, because direct DPC and DSC doctors aren't spending half their time dealing with insurance paperwork, billing codes, and authorization forms, they can see a lot fewer patients. Instead of caring for 2,000 to 3,000 patients, a DPC doctor might have 300 to 600 patients. What does that mean for you? It means you can actually get an appointment when you need one. It means your doctor actually has time to talk to you on the phone about your concerns. Timely follow-up appointments are common in direct care practices. No more waiting weeks or months for a 15-minute visit or even less, which gets me to my third point. Appointments are longer to actually allow you to have an in-depth discussion with your doctor. Instead of those 7 to 15 minutes, you're looking at 30 to 60 minutes per visit, or even more if needed. That's a huge difference. Just think about how even that difference can impact your health and lower your stress from unaddressed concerns. And fourth difference, you have direct access to your personal physician. At Essence of Health, my patients can text me, email me, Call me directly. No lengthy phone tree, no hoping that I actually get your message from the 3 other people that you may have had to talk to in order to express your concerns and actually leave a message for your doctor. If something comes up and you need guidance, you don't have to wait weeks or months to be seen. You don't have to go sit in an urgent care waiting room. You don't have to sit in the waiting room for 2 hours either, because no one is double or triple booked. You can reach out to me directly and we figure it out together. Now, let's talk about the cost, because I know that's on your mind. You're probably thinking, well, Dr. Shayla, this all sounds great, but how much does it cost? Monthly membership fees for DPC practices certainly can vary, because these practices are typically owned and operated by independent physicians, not large corporations. But nationally, the average cost can range from about $75 to $350 per month, depending on the practice, the location, and the service offerings within the membership at that particular clinic. One of the tenets and great things about direct care practices is price transparency. So you can go to Essence of Health's website right now and see our membership pricing and service offerings. It's an investment in your health, but you deserve high quality, accessible health care. Now, let me show you how the math can actually work out in your favor and often be cheaper than your traditional insurance-based plan. So let's say you're currently paying $300 a month for insurance through the marketplace. And that's actually on the low end for most people since the subsidies expire. But that's $3,600 a year. Plus, let's say you have a $5,000 deductible. So you're actually paying a total of $8,600 out of pocket before insurance even covers anything beyond your one brief wellness visit for the year with your PCP. Now, let's compare that to a direct care practice. Let's say you pay $275 a month for a DPC membership. That's $3,300 a year. And the majority of your healthcare is fully covered for the year. Yep, all of your visits, all of your time with your doctor, access to low-cost comprehensive lab testing, access to low-cost prescription medications, guidance on high-quality supplements, often with discounts, lifestyle coaching, everything. Then you pair your membership with a high deductible catastrophic insurance plan. Let's say $150 a month. That's $1,800 a year. So your total annual cost is $5,100. With the traditional insurance model, you're paying $8,600 before insurance kicks in, and that doesn't come with any actual access to your doctor in the meantime, and doesn't account for any copays. With DPC plus catastrophic coverage, you're paying $5,100 total, and the majority of your healthcare is fully covered with easy access when you actually need it. That's a savings of $3,500 a year. Plus, you're getting better, more comprehensive care with your personal physician, who you get to see each time you visit the office, because that relationship is important for your health as well. But beyond the numbers, let me tell you why this model is so powerful for women who need comprehensive, functional, and integrative medical care. Because I have time with you, I can actually practice the kind of medicine I was trained to practice. I can spend an hour understanding your history, your symptoms, your goals. I can order comprehensive hormone panels, metabolic panels, nutrient testing, all the things that insurance typically won't cover or will deny. And remember that price transparency I mentioned? Because as a member of Essence of Health, you get access to significant discounts on your lab testing, and you'll know the price before it's ordered. Yep. So no surprise bills in the mail for something that you thought your insurance was going to cover, and you're not paying thousands of dollars for lab testing. And also within this model, I can create a personalized plan for you that addresses your unique needs, because I have time to dedicate a higher quality of care to you and not thousands of people at one time. Also, in the direct care model, you're paying your doctor directly instead of the insurance company. So you're the priority, not the insurance company. No quotas to meet. The goal is just to provide you with high quality, accessible care. Let me give you a real world example of how this works. Let's say you're Sarah, you're 48 years old, you're in perimenopause, You're having hot flashes, brain fog, weight gain, mood swings. With your old insurance plan, you were paying $250 a month for premiums. You had a $5,000 deductible. You saw your doctor for the one wellness visit that your insurance actually covers, but your doctor didn't have time to address these concerns or mention to you that you may receive an additional bill because your insurance doesn't cover a problem at your wellness visit. So, no comprehensive hormone testing was ordered because you're told that insurance probably wouldn't cover it anyway. No one could offer you any other way to get the testing you may need with options either. You were told to just schedule a follow-up or given a prescription for something that you're not even sure what it's for. Now, with the direct care clinic, you're paying your monthly flat membership fee. You get monthly check-ins with me where we can monitor your symptoms and adjust your plan as needed. We run comprehensive hormone panels with transparent discounted rates to see exactly what's happening with your estrogen, progesterone, testosterone, cortisol, and complete thyroid function. We create a personalized healthcare plan. You can text me anytime you have questions or concerns. Plus, you have a catastrophic insurance plan for $100 a month in case something major happens that lands you in the hospital. Your total monthly cost, about $400. Is that more than $250? Yes. But you're actually getting care that's transforming how you feel. Whereas before, you were just suffering through because you couldn't actually access the care you were paying for without actually paying even more money. This is why I love offering care to my patients within the direct care model at Essence of Health. Because for women dealing with hormone imbalances, metabolic dysregulation, chronic inflammation, all the things that don't fit neatly into a 15-minute or less visit, this model allows me to actually help you heal. I actually get to know you. I have time to hear you and can help you prevent problems before they become expensive health crises. And here's what the research shows. Studies published in peer-reviewed journals have found that direct care patients have higher patient satisfaction rates, fewer emergency room visits, fewer hospitalizations, and better management of their chronic conditions. Now, I do want to be clear about something. The DPC direct care model isn't for everyone. If you have a lot of chronic conditions that may require frequent specialist visits, hospitalizations, or expensive specialized medications, then you still will need comprehensive insurance coverage. Direct care works best when paired with a catastrophic or high deductible insurance plan that covers major medical events, surgeries, hospitalizations, that kind of thing. But for the majority of your care, for the day-to-day management of your health, for prevention and addressing hormonal and metabolic imbalances, for having a doctor who actually knows you and has time for you, being a member of a direct care clinic practice can be absolutely life-changing. So we've covered a lot today. We talked about how insurance premiums are skyrocketing this year and what this means for your wallet and your health. We talked about how financial stress affects your hormones, your metabolism, and your overall health. We talked about why the traditional insurance model often fail those who need more in-depth care with the functional, integrative, and lifestyle medicine approach. And we talked about direct primary care and the direct care model as an alternative model that may simply work better for you. So, what's next now that you have all this information? Well, first, ask yourself, am I getting the care I need? Am I getting care that's actually helping me feel better? Or am I just paying for insurance that I'm too afraid to use because of the cost? Second, download the free resource I've created for you. It's called the Doctor Approved New Year Health Reset Checklist. This is the same framework I use with my patients at Essence of Health before we dive into weight loss or hormone optimization. I assess 5 key areas to make sure your body is ready for change. You can grab this for free by going to drshayla.com/freebies. Yes, it's totally free, no strings attached, and it's a great starting point if you're feeling overwhelmed and don't know where to begin. Third, if you're thinking, this DPC model sounds interesting, but I want to learn more, I invite you to book a free consultation with me. We can hop on video together. I can learn more about your specific health concerns and goals, And we can talk about whether becoming a member at Essence of Health Wellness Clinic is the right fit for you. There's no pressure. It's just a conversation. You can book that consultation right on my website at essenceofhealthwellnessclinic.com. And if you're not in the service area of Essence of Health, but you want to find a direct care practice in your area, search for the Direct Primary Care Alliance, the Direct Specialty Care Alliance, or Atlas DPC MAP to find a direct care doctor in your area. For those listening in the Atlanta area, we're opening our new Atlanta location and have opened up the Atlanta Founder Circle for our first 10 members with some really special bonus benefits, including a free comprehensive metabolic lab package, continuous glucose monitoring, and more. So if you've been thinking about getting serious about your health this year, well, now is the perfect time. Learn more to go ahead and grab one of those 10 spots at drshayla.com/EOH. Before we go, make sure you subscribe to the Essence of Health Tea Time podcast on your favorite podcast platform so you never miss an episode. And if you've enjoyed today's episode, I would really appreciate you leaving a 5-star review. This season, we'll be reviewing more health news and giving you the integrative and functional medicine expertise on the topics that matter to you most. Until next time, remember, you deserve healthcare that actually addresses your needs. You deserve a doctor who has time for you. You deserve to feel well in your body, to have energy, to have mental clarity, to thrive, not just survive. And don't forget to grab that free New Year Health Reset checklist to help you get started. Remember, the essence of health is in you. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.